Istoege logo yichota ngeta kinige county nebo Nandi olega go gimit governor nebo county nebo Nandi Stephen Sanga kule chabota serikali tab county nebo Nandi kobun ministry nebo tililindo nebo ko bois en muswangnatet nebo kasari en kasuldaet nebo konyoiset en sipitalisiek tugul en county nebo Nandi en mwaet kule tetutonoton gowendi kotoreti sector nebo tililindo konyor chepkondok kiamotin en kasuldaet nebo boisionik kobun tuget nebo konyoiset nelel nebo SHA kongololi ine yekangolumdo tetutit nebo Taifa Care Nekagiyaen sipitalit nebo referral nebo Kapsabet.
Many of our facilities were losing resources. Today, as we roll out this program, no service will go unclaimed because the claiming will be automatic as you provide the service from the triage all the way to the lab, all the way to prescription, all the way to the pharmacy. Every service point, there will be an automatic claim. And therefore, in another 2-3 months of rollout of this program, you will be surprised by the amount of resources that we will be having in our facilities. And therefore, that will support the process of ensuring that we have resources available for our facilities and our use in our facilities. We sit down as Council of Governors and together with Ministry of Health. The big question that we ask, why are we still having private facilities getting more disbursements from SHA than public facilities with regard to their numbers? Because the public facilities, Kenyans utilize public facilities to a high percentage of about 80%. All the private facilities are, account for about 20%. But when you look at the disbursements from SHA, you still realize that the private facilities are still slightly higher than public facilities. One of the major challenges is that we have never invested in government equipment that can and facilities that can help us claim for every service that we offer. When the program is rolled out in your facility very well, you increase the resources in your facility. So let it be one of the ways of generating on-source revenue for your facility, be the effective rollout of this program. It will increase your resources in your facility.
En kasratan gogi meet Governor Sangole meeting alagen kete sosi ke tililindo jogote stay gonyor chige chepkondo kia Martin kotab ko boisien tutanetana ole en komastanyen sisi ne tililindo en serikali tab county ne Nandi Angeline Kirui ko magole tinyen kayaneta kole wendi gonyemi muswangnatet ka kaitoit ne konyoiset ko tibiga ba boror.
Very success stories of a hospital or a dispensary or a health center that used to get a total of, for a whole year, about maybe 70,000, 80,000, 120,000 from the many programs that we had, whether it is Danida or all the others, in a whole year. Today, they are getting an average of between 400,000 to 600,000 a month in a facility for the last 20 years. You are used to the normal paper trail in terms of providing our services. When you are told that you now have to do literally everything on the gadget, that transition is going to be a bit challenging. And you will see it at the start, you will think that this is an inconvenience.
We know we have a shortage of health workers, but then they deliver despite the small numbers. And we are optimistic that soon we are going to have the number improved, and continuously we will improve on the efficiency and the delivery of health service in our county. Digitization of services is just that epitome that we've been looking up to, and then as we attain it, then let's ensure that we always excel.